Karnataka chapter. We would like to welcome
You are not audible, Dr. Prashant.
Good evening, everyone.
Hi, Pratap.
It's indeed a pleasure. This is an totally a different platform altogether. And for NNF Karnataka and even for the other platforms, this type of book launch is little unusual because of the situation what we see. We are extremely happy that today we all have come together to fight COVID pandemic as one unit. Today
Breaking too much, not heard well. Prashant, your voice is not at all heard well. It is completely breaking.
Am I audible now, sir?
So you are audible now and then, but not continuously.
Just one.
It is irregularly irregular.
Ravi, namaskara.
Namaskara.
ನಮಸ್ಕಾರ ಕುಲಕರ್ಣಿ ಅವರೇ.
ಕುಲಕರ್ಣಿ ಅವರೇ ನಮಸ್ಕಾರ. ಸ್ಮಾರ್ಟ್ ಆಗಿದ್ದೀರಾ ನೀವು?
ಸರ್ ನಮಸ್ಕಾರ ಸರ್.
ನಮಸ್ಕಾರ.
Sure, you just unmuted yourself. Good.
ಇನ್ನೊಂದು ಅನ್ಮ್ಯೂಟ್ ಮಾಡು.
Hi Ranjan.
You unmuted yourself just now. You are on mute.
Yeah. I didn't realize. I thought I was talking.
Oh, Balik Mam.
Sir, am I audible now, sir?
You are audible. Shantaram.
Audible, sir?
Good evening.
Voice is clear, sir?
ಬ್ರೇಕ್ ಆಗ್ತಿತ್ತು ಅಷ್ಟೇ.
ಪ್ರಶಾಂತ್ ನಮಸ್ಕಾರ.
ಇವಾಗ ಕ್ಲಿಯರ್ ಆಗಿ ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಸರ್?
ಇವಾಗ ಕೇಳಿಸ್ತಾ ಇದೆ.
Yes, sir.
Go ahead.
Yeah. Singh, can you kindly unmute all?
Prashant, how to share the slide, Prashant? Girija, how to share the slide? How to share the slide for Girija?
Sir, we have made her as a presenter. In case if it is not opening, I'll open from here, sir.
Okay, I have sent it in the PPT.
Okay, sir. We can start the program now, sir. So, I would like to thank everyone for spending the time and joining on this occasion. And can you talk? A lot of disturbances there. Thank you everyone for joining for today's
Prashant, you're frozen.
I don't know what is happening.
Prashant, the freeze are three.
Am I audible now?
You're
Yes.
audible.
Sir, am I audible now?
Yes, you're audible, but you're frozen.
Yes.
And other one is okay.
Yes, sir. Yes, sir. I think the laptop, there is something it's suddenly getting off. Anyway, I'll do with this. So
Hot-
quickly, we'll start the function. Yes, sir. Again, welcome all. On behalf of NNF Karnataka, we would like to give a warm welcome to all the chief guests and delegates who have been attending. We would like to welcome our Indian Academy of Pediatrics Karnataka chapter and Bangalore Pediatric Society, FOXI, KSOG, Karnataka State Obstetric and Gynecology, BSOG, IMA, and NNF India, and our government of Karnataka. This today's occasion, it was not thought from very long time. It was a short notice. The entire sequence started with the initiation from our UNICEF South consultant, Dr. Sri Krishna RSV, and he came up with a proposal of making a COVID-19 protocol. And following that, initiation of the protocol started. So we had so many protocols from ICMR, WHO, CDC, and WHO, and FOXI, and even our Indian Academy of our NNF India, FOXI, and Indian Academy of Pediatric had done nationally. But one thing what we have observed is COVID, from the time how we were managing in the month of March and how we are managing now, it's totally changed because it's a new disease and it has evolved and spread very rapidly. And the need of the hour was all the organization to come together to fight this pandemic, and that is the point where the UNICEF with NNF Karnataka, we initiated this, and we got a wonderful support from all the organizations. So wholeheartedly on behalf of NNF Karnataka and members of NNF Karnataka, we would like to give a warm welcome and thank you for participating. It's a wonderful thing. So on behalf of NNF Karnataka, we would like to give a warm welcome for all the delegates and all our chief guests. So to start with, I would like to welcome our senior most neonatologist from our fraternity of neonatal chapter Karnataka, Dr. P.P. Maya sir, Swarnareka Bhatt madam, Guru Prasad sir, Sahana madam, Shantaram Baliga sir, and our office bearers are NNF India elect Dr. Ranjan Pejawar sir, President elect 2021, our President Dr. Kotreshi sir, our Vice President of NNF Karnataka chapter Dr. Kishore Kumar sir, our Treasurer Dr. Dinekar sir, and our Joint Secretary Dr. Leslie sir, Sidhu, Soil, Kumar, Raghavendra, and our entire EB member. And the best part about today's book launch wouldn't have been possible without the support of Bangalore Pediatric Society and IIT Karnataka chapter, BSOG, FOXI, and KSOG, and IMA. So I would like to give a warm welcome to Dr. Ravishankar sir, President BPS Karnataka, Dr. Shantaraj sir, President IAP Karnataka, Dr. Madhusudan sir, President IMA Karnataka, Dr. Gautam Suresh sir. He, being outside the country, he extended his support in terms of reviewing the book. Thank you very much for doing that, sir. And we would like to extend our welcome to Dr. Alpesh Gandhi, FOXI President, Dr. Shobana ma'am, KSOG President, Dr. Tejavati ma'am, President BSOG, Dr. Sri Krishna RSV from UNICEF India, and Dr. Sanjeev Upadhyay, Health Specialist, UNICEF India, Dr. Ashok Derari sir, our President. He took time in his busy schedule to review the article quickly and give his feedback. Sir Ashok sir, we are very, very thankful to you as well, sir. And we would like to give a warm welcome to you as well, sir. And all these things wouldn't have been possible without the support of our Vaidehi Medical College staff, our nursing staff, and Dr. Girija, who has been a backbone for this particular formation of the COVID protocol, Dr. Hafiz, Dr. Vikas, Dr. Pushpalata, and most important, blessings from our own past president of NNF Karnataka, Dr. Bidri sir. Sir, you have been always constantly in touch and giving your feedback. Thank you very much for that, sir. And we would like to extend our welcome to Dr. Narayan Swamy sir, Dr. Vijay Kulkarni sir, and we have got appreciation from Chief Minister. Thank you, Dr. Kotreshi sir, for making that happen and getting an appointment with our Chief Minister. And we were able to explain what we are trying to do with this protocol and what is the aim and objective of this protocol. It's not just bringing out the book, it is to bring out the training in each and every essence use of Karnataka, so that once we are prepared and trained, once the mind knows, it is easy for us to handle such a big pandemic which we are facing. And we got appreciation letter from our Deputy Chief Minister. So we would like to thank and show our regards to Chief Minister of Karnataka, Mr. B.S. Yediyurappa sir, Dr. Rashwat Narayan sir, Dr. Sudhakar, and our health minister, Dr. Sriramulu sir. So it is fantastic that all of us have, all of them have come together to support this noble event of bringing the protocol and helping us in formulating the workshops for SNCUs to train nurses and doctors. So we got good support from Dr. Shekhar Subaya in terms of approaching and getting appreciation and the work what we had planned from Deputy Chief Minister. So we would like to welcome Dr. Shekhar Subaya as well. And Dr. Venkata Chalapati sir, he helped us in terms of getting recognition from our medical minister and explaining the importance of how important the protocol and how important is the training. Thank you very much for that, sir. And we would like to extend our welcome to our past president NNF India, Goswami sir. And he has been a constant support, and especially for Karnataka, he has showered a lot of support. And we extend our warm welcome and regards to you, sir. And our own beloved and most my favorite, Dr. B.D. Bhatia sir. Thank you for extending your blessing and support to us, sir. And Dr. Ramesh Kumar sir, you have been very helpful in terms of reaching out this protocol book across the Kerala and your known places. Thank you for extending your support as well, sir, and showing interest and extending your warm support. So we would like to welcome you as well, sir. So now the entire sequence of event, as I said, it started from UNICEF initiating and sending an intimation to NNF Karnataka chapter, and then the chain of reaction happened, and we all have come together. So if I have missed anybody, I would like to extend my apology, knowingly or unknowingly. So let us start the function. So the function will be like this. So after the welcome speech, I request our expert committee and senior neonatologist, Dr. P.P. Maya sir, Swarnarekha Bhatt madam, Guru Prasad sir, Sahana sir, and Shantaram Baliga sir to speak a few words. We request them to keep it within 2 minutes. Then a brief description of the book will be done by Dr. Girija and Dr. Dinakar Prithviraj sir. And we have appreciation message and extension of support in terms of continuing this project of making protocol and training the nurses and doctors across Karnataka by Dr. Ravi Shankar sir. He is the BPS president. Dr. Shantaraj sir will speak after that. Madhusudan sir will be guiding. And then once our appreciation is done, our NNF team from Karnataka and our NNF elect president, Dr. Ranjan sir, will speak a few words. And then followed by that, the editorial committee, on behalf of editorial committee, I request Kishore Kumar sir, Bidri sir to speak a few words. So I'll be telling at every time, this is how it's going to be. And then I request, I have sent the latest updated high resolution COVID-19 protocol soft copy to all of my speakers. So kindly open that after the speech is done. So the entire program we have planned approximately around 1.5 hours. After that, we're going to have a book launch, and I request all of them to take a photo of the place wherever you are right now. With you can request your colleagues, whoever is there next to you, to take a picture and send it to us. So we're going to keep this. The entire event is recorded, and we'll be sharing all the recordings because this is going to be a very good memory for us. And since it's been a little different way of launching the protocol and meeting up on this occasion. So now I request my senior most neonatologist and well respected and most appreciated our expert, and they are part of our expert committee. So I request Dr. P.P. Maya sir to speak a few words about his experience and about the need of the hour. Over to P.P. Maya sir. Maya sir?
Yeah.
Yes, sir.
Thank you, Dr. Prashant. Can you hear me?
Yes, sir. Yes,
Yeah,
sir.
can
We
you hear
you,
me?
sir.
Yes. Friends, representative of Government of Karnataka, UNICEF, members of the KNNF, IAP, KIAP, IMAK, KSOG, BSOG, and FOXY, and so on. It's indeed a great moment and privilege for me to be with you all on the occasion of the release of e-book on SOP for the management of antenatal, intranatal, postnatal, and newborn. COVID outbreak has posed great challenge to healthcare community all over the world, infecting millions of people, causing significant morbidity and mortality. Unfortunately, this pandemic did not spare even pregnant mothers and their newborn babies and children. It's quite heartening to see for the last, the few days ago, I saw in a newspaper about 100 COVID positive pregnant mothers gave birth to the babies at Vanivilas Hospital attached to Bangalore Medical College, and they celebrated the 100th baby. It's something quite interesting, and it definitely gives us confidence to all of us to care for COVID positive mothers and newborn babies. I salute all those who are involved in this. And as such, our state is yet to see a peak of this epidemic. The threat of COVID pandemic does not disappear so soon, sir. And nobody knows how long it will go on. And we all know by now that guidelines for management and preventing the spread of the virus is changing every now and then as more and more inputs coming by experience. This SOP being released today will be of immense help for those who are caring for mother and babies. I am sure this will be a good companion, pocket companion for an obstetrician and neonatologist. I congratulate on this occasion the Karnataka NNF office bearers joining hands with various professional organizations, international organizations, and government of Karnataka. This book has very comprehensive guidelines maintaining quality of coverage and accommodating and implementing life-saving interventions during the time of pandemic. Another highlight of this book is this book tailored to the needs of essentials of Karnataka. And lastly, I would like to brief to our young colleagues to take all personal preventive measures in combating the infections and senior physicians and surgeons to stay at home and giving constant encouragement, moral support to all frontline warriors. Thank you, Dr. Prashant.
Thank you very much, sir. Now I request Sodarika Bhatt madam to speak a few words. Over to you, ma'am.
Good evening to all the dignitaries on the e-platform and to all the participants. I can see the number of 122 participants. Good evening to all of you. First of all, I would like to congratulate the office bearers of the various academic bodies for coming out with this guideline for the management of the mother-baby diet. affected by the COVID pandemic. I'm happy that NNF Karnataka has taken the lead along with UNICEF and Government of Karnataka and has brought out this guideline in collaboration with all stakeholders, which is extremely important. As Dr. Maya said, and as all of us are aware, this pandemic has affected every individual across the globe. And it has placed an additional responsibility on the healthcare workers to ensure safe care of patients and themselves. The last few months have been a learning curve as far as COVID, how to protect, how to prevent, and how to treat our patients. There's been confusion over various aspects, including what are the precautions, how much precautions, how much protection, when to test, how to manage. And a guideline such as this, I think, is extremely important and extremely useful to ensure uniform care, and will certainly help practicing obstetricians, neonatologists, and pediatricians in taking care of the mother-baby diet. Once again, congratulations. And I'm very happy that Prashant mentioned that this is the beginning. One, in terms of that we are going to be revising the protocol as and when new knowledge comes up. Two, the team is going to take it forward in terms of training and ensuring implementation of the protocol. Congratulations once again to all the office bearers, particularly the current ones, and wish you all the best in carrying this work forward. All the best, and stay safe, everybody. Stay safe, everybody.
Thank you, ma'am. Thank you, ma'am. I request everybody to kindly mute. Singh, can you mute all? So we'll request one specific person, then we can unmute. Can you mute? Yeah, so now I request Dr. Guru Prasad, sir, to speak a few words. Over to you, Guru Prasad, sir.
Friends and members of NNF Karnataka State Chapter and members of other bodies, be obstetricians or Bangalore Pediatric Society, and across the country you are attending this program. I think we are faced with probably a natural disaster, biological disaster of our lifetime, COVID, since December 2019, the first case which was reported in Wuhan. And gradually it has spread to the rest of the world, and nearly 1.5 crore population across the globe is affected. And at this point of time, the most susceptible group are the pregnant mothers and the just born babies. So as these cases are evolving across the globe, we started learning how to really go about. And as my early speakers said, Dr. Mayer sir and Swarnareka madam, we are learning with time, and whatever level of evidence that is available to tide over this moment is based on low level of evidence in literature. And fortunately, so far things are fine. But as it is speaking everywhere in the country, and Karnataka in particular, last 2 to 3 weeks are very bad. We are reaching almost 1 lakh population, and we are likely to see more cases. We should be prepared for that. And I think Dr. NNF Karnataka State Chapter has done a wonderful job. Last 3 weeks, they have put their heart into that. Earlier, they were known for their ease and webinars that were held across the country. And now this is a great venture that they have done. I like to congratulate Dr. Prashant Gowda and Dr. Dinakar and team. In 2 to 3 weeks' time, they managed to get all the available information and come out with a very comprehensive model. Yeah. At this time, I just like to share All India Institute of Medical Sciences, New Delhi has taken a lead for a prospective cohort study of COVID in pregnancy, and 20 sites have been chosen for that. And I'm happy to share that 3 of them are from the state of Karnataka, KLE Belgaum, Jain Medical College, JJ Medical College, Davangere, and KIMS Hubli. And probably the enrollment will begin from August 1st.
And over time, I think we'll learn a lot of things. And these SOPs are likely to change as we start generating our own evidence. So at this point of time, I think they have done a great job. This SOP is definitely going to help people to be trained and start practicing it, especially in SNCUs, taluka hospitals, and even district hospitals and medical college hospitals. As a past office member of NNF Karnataka State Chapter, I'd like to heartily congratulate the entire NNF present office for a great job and wish for this program all the success. Thank you everyone for your patient hearing.
Thank you for such wonderful words, sir. Thank you very much, sir. It's very encouraging. Now I request Dr. Sahana ma'am to speak a few words. Over to you, Dr. Sahana ma'am.
Can you hear me, Prashant? Can you hear me?
Yes, ma'am. We can.
Yeah.
Yes, ma'am.
Good evening to one and all the esteemed people on the platform, members of all the 7 agencies. I'm so happy to share my experience here, and I congratulate NNF Karnataka for doing all this wonderful work on this platform. And in this current COVID scenario, which is an unprecedented situation, which is causing a lot of havoc. And we had I'm happy to share that we had about, as Maya sir said, we had 172 deliveries so far. Today also we had about 6 to 8 today. And so far we have, since last 3 months, we had 172 deliveries. And happy to say that only about 9 babies were positive. Those babies were from the postnatal side where babies were referred from. Initially, we had so many hassles and we had to do the protocols twice or thrice, and recently also we made. And when Prashant approached me, I was happy to share our protocol, and it's very happy that this SOP is the need of the hour. First time ever so many professional bodies have come together for a common cause, which is the need of the hour. And this initiative will help in better cooperation in the perinatal and neonatal care. And it helps in the uniformity of care across the region in regarding data collection or data sharing, and it helps in identifying the gaps in the healthcare system too. And it provides a template for even the private sector to adapt, because when I get a call every day, I keep getting calls from the outside private people also, what you people are doing, like that. So this platform has helped us to have one SOP which has a clear guidelines on it. And I'm so happy, and congratulations to all the NNF members for doing this noble cause, like Sabke Saath and Sabka Vikas. Thank you so much.
Thank you, ma'am. That was a very good note, and this is the need of the hour. Sabka Saath, Sabka Vikas.
Yeah.
Thank you, ma'am. Thank you, ma'am. Now
Okay.
I request our beloved Shantaram Baliga sir. Now I request our beloved Dr. Shantaram Baliga sir to speak a few words. Over to you, sir. Over to you, sir. Over to you, sir.
Thank you. Thank you, Prashant. Good evening to one and all, especially to the members of other organization who have joined hand. So all of us know that this is a pandemic which we have to face. It's a testing time for all. I'll not talk anything about the book, but going beyond the book, the Karnataka NNF and the other organizations who have joined hands have given a big message to the entire country, that is to join hands, come together and converge to prevent the deaths, to reach out to the people who are suffering from COVID-19. And that's the way forward across the country. The best part of this program is that in spite of adversity, you can create a platform, put things in place.
Can you mute all things? A lot of disturbance is there, sir. One, sir. The recording, we want our message to be very clear, sir. We'll mute. Kindly unmute.
Done, sir. Done, sir.
Yes, sir. Please go ahead, sir.
So many organizations now come together, they have joined hands, and they have converged for one cause to treat the mothers and neonates who are suffering from COVID-19. Coming together in spite of all adversities, and this has given a lot of clarity to the treatment protocols, which helps in improving the quality. All along, the approach was to expand, but quality was not given as much importance as it required. So this particular approach will definitely improve the quality not only in private sector, but also in the government sector. And taking the private sector and organization along with it depends on the leadership of the government, and hope that government adopts an inclusive approach rather than a punitive approach, appreciate contributions by private sector, and utilize the quality services in fighting this pandemic. And our approach is going to change from prevention of spread of the pandemic to saving lives. And I think this protocol and algorithms which are given will go a long way in saving a lot of mothers and neonates. And not only, it will give some direction for other organizations to join hands and join with the government in fighting this pandemic. I must congratulate the NNF Karnataka and all other organizations which have come together to prepare this book, which will definitely improve the quality of care of COVID patients, not only in the state, but in the country too. All the very best. Thank you for this opportunity.
Thank you very much, sir. It's a wonderful life lesson words, what you have spoken, sir. Thank you very much for that. So before I request Dr. Girija to say a to go for a brief description of book, I would like to introduce our editorial committee and design credits. This book wouldn't have been possible with such a short notice. It's like we have played exactly a T20 match, every day hitting almost century of working for almost 14 to 18 hours. This team is headed by our beloved and respected Dr. Dinakar sir, and this protocol, the contributions by them is immense, and followed by Dr. Girija, who has put her heart out, and even with kids and carrying, she has put her 100% effort. And this wouldn't have been possible without the support and constant support and blessings and constant guidance from our respected and beloved Dr. Kotreshi sir, and our Vice President Dr. Kishore Kumar sir, and backed by our advisory committee head for our academics, Lakshman Bidri sir. So I request, I'll take one by one name of all our editorial committee members who have worked really hard to bring this book out in such a short notice. I request them to say hello so that everybody knows that who are those editorial members who have put effort. So to start with, I'll start with our president, Kotreshi sir. His contribution, even though his health was not that great at the time when we started, by the time we finished the book, his health also recovered full-fledged. Sir, Kotreshi sir, please say hi to everybody, sir.
Hello. Hello to everybody.
Yes, sir. Yes, sir.
Very nice to see all the figures in the dais. And I very much appreciate
Prashant.
Yes, sir.
If you remove this PPT, if somebody tells hi, they will be seen on the screen.
Yeah. Can you just stop PPT? Because I want everybody who's there in the
their face will come on the screen when they tell yes.
Kotreshi sir, yes sir.
Hello,
Over to you, sir.
Okay, fine. I'm very thankful for the whole team, especially Prashant and Dinakar Girija, who has been a wonderful work on this recent concept, especially neonatal and maternal care.
Thank you, sir. Thank you, sir. And I request now technical support was given by our and complete the approach and the technical support was given by our Vice President and our beloved Kishore Kumar sir. Kishore sir.
Good evening, everyone. This is the best example of everybody coming together for one cause, and I sincerely thank everyone for having contributed and joining hands to make this possible. And definitely, it's the way to move forward. And unity is the strength, though union is not the strength with COVID. Thank you very much.
Thank you, sir. Thank you, sir. Now I request our favorite Bidri sir. Over to you, sir.
Hello, good evening, everybody. At the outset, I thank all the agencies supporting this noble cause, and especially I am proud of our team, NNF Karnataka team, for having brought out this SOP within such a short time, and this SOP will definitely help the obstetrician, neonatologists, and the pediatricians to take care of the pregnant mothers and neonates. Thank you.
Thank you, sir. Thank you, sir. Now I request our Dr. Narayan Swami, sir. Narayan Swami, sir.
Yeah, hello.
Yes, sir.
Can you hear me?
Yes, sir. We can hear you, sir. Go ahead, sir.
Yeah, good evening, ladies and gentlemen, and it's been a great effort.
Can I request him to mute all?
And as this is the greatest pandemic worldwide, and where the
Narayan Swami, sir, can kindly unmute and continue speaking, sir. Narayan Swami, sir, kindly unmute.
Can you hear me?
Yes, sir. Yes, sir. We can hear you, sir. We can hear you, sir.
Yeah. So thank you very much, and good evening, everybody. And it's been an honor, a privilege to be a part of today's evening program. And as we all know, this COVID-19 is such a pandemic worldwide, and where even the guidelines are changing day to day, gray areas of the disease. And I'm so happy that so many organizations have come forward, joined together to bring out such a wonderful booklet. And this will go in a long way to knowledge of teaching obstetricians, gynecologists, and neonatologists. And I really appreciate all the hard work, particularly of the people who handle this scenario. Thank you, everybody.
Thank you, sir. Thank you, sir. Now I request Dr. Girija, who has been one of the backbone for this book to come out. Over to you, Dr. Girija. Dr. Girija. Dr. Girija. May I request Dinakar, sir? Dinakar, sir? Dinakar, sir?
Yeah, hello, Krishna.
Yes, sir. Yes, sir. Yes, sir. A quick word, sir. Girija, are you there? Girija, are you there? Kindly,
Yes,
quick words, quick words.
Yes, sir, I'm there. Can you hear me?
Yeah, we are able to hear you. Please go ahead. Please go ahead. Dr. Girija, quick
Yes,
words
sir.
from you.
Dear colleagues and friends of pediatrics, obstetric and gynecology, NNFK together with UNICEF, we have discussed about how to prepare the guidelines 15 days back. The NNFK members agreed to give them in detail, and we approached the government, the healthcare officials, and the renowned organizations like Central NNF, IFP, KSOTA, PSOG, FOGSI, IMA, Central NNF, and have come together to bring a comprehensive book on the guidelines of antenatal, intranatal, postnatal, and neonatal management of COVID-19 to strengthen our fight against the corona.
Dr. Girija.
Guidelines in this document are based on limited evidence as available now. As new evidence accumulates, some of the recommendations may change. Users should use these guidelines in accordance with the latest government regulations and ICMR advisories. Modifications at the individual, institutional level may be needed in case of non-availability of resources, infrastructure, manpower, and equipment. Organization and government and their staff make no representation or guarantee that these compilations of information are error-free, and only the main author take responsibility for the images and information used. We have used some images and charts from many journals only with the intention of academics and teaching all during the COVID-19 pandemic for the benefit of humankind. Some minor changes have been made in few images as per the local guidelines. Thank you with courtesy for all the authors and the image designers. I'd like to introduce my team who was helped me in this effort. Dr. Patrice sir, Dr. Dinakar sir has been pillar and shunt for this book, and myself, Dr. Girija. I sincerely want to thank my postgraduates, Dr. Afiz, Dr. Navya, Dr. Pushpalata, Dr. Aisha, Dr. Vikas. Without their effort, this book is nothing. And my sincere thanks to Dr. Jyoti Bandi, Dr. Garima, and Dr. Sidhu Chakri, and Dr. Arvind N for their input. My special thanks for Dr. Tejavati ma'am and Dr. Alpesh Gandhi for the lot of input in the obstetrics and gynecology. And my special thanks to Dr. Gautam Suresh and Dr. Ashok Birare sir. So coming to overview what this book contains, it has the introduction and COVID-19 in pregnancy. It includes all the antenatal care, intranatal and postnatal care, delivery room management, and NRP guidelines during COVID, isolation and ICU, neonatal COVID-19, and isolation in postnatal ward, symptomatic outborn babies requiring an ICU admission, and feeding protocol. And to make point here, we have emphasized on breastfeeding, the importance of breastfeeding, the importance of KNC during this COVID-19 pandemic, the infection control practice during COVID-19, and the visitor policies. We have highlighted the ethics and report of death, autopsies, and disposal of the bodies during COVID-19. We have also emphasized on telemedicine and its use during COVID-19. We have added this special about vaccines and drugs and hypotheses and speculation of COVID. Since there is short of time, I'll just go through slides. This wall it contains. Since there is less time, I'll just slide through the slides. Is the comprehensive algorithm for the antenatal care, which is there in the book, and how the pregnant woman has been categorized for the mild, moderate, and the severe symptoms, and the algorithm for the isolation and suspect or confirmed cases of COVID-19, and how to manage women in during COVID-19 in pregnancy. And there are a lot of issues like whether delayed cot clamping and skin-to-skin contact, anesthesia and analgesia. We have gone through all the guidelines and we have included what they say. We have a comprehensive pictures. And we have gone through the delivery room management and the NRP guidelines during COVID and the importance of aerosol precautions. Neonatal COVID, we've gone through all the definitions of neonatal COVID and how it presents, what are the symptoms and what are the lab investigations. The importance of RT-PCR over here which were taken for the ICMR guidelines. My heartfelt thanks for the ICMR for their comprehensive guidelines. And management of neonate born to suspected and confirmed COVID-19 mother. We have the sick neonate of suspected and confirmed COVID-19 mother. And how to isolate in the postnatal ward for the suspected or confirmed mothers. Symptomatic outbound requiring NICU admission. Here we have emphasized from hotspot or postnatal exposure to COVID-19 mother. We have highlighted the importance of breastfeeding during COVID, and we have taken all the guidelines into the consideration. And we have highlighted the need of KMC for the low birth weight babies and preterm babies. And along with that, what makes this book unique is we have added the vaccine update and the images, hypotheses and speculations. We have added on mental health and ethics during COVID. And we have even kept the government and the private hospitals which are taking the COVID cases and the helpline numbers, which will be helpful. And disposal of the bodies and biomedical waste management have been included in the book. My mentor, Dr. Dinakar sir, will take over from here.
Myself, I am Dr. Dinakar. Okay, I want to introduce my team. We have worked 15 days back. Actually, UNICEF, they have asked us, can you do it, Dr. Sir? Later, we told only one thing. If the government is involving, it will reach to the many people. Then we requested our president, can you help us? Our president straight away called CM. Is it possible? So CM sir told, yes, it is possible, provided you should satisfy our team of government. Then only we will take. Then we have taken NNF guidelines, OXI guidelines, UNICEF guidelines, WHO guidelines, CDC guidelines, AOC, after taking those things, and at the same time we used many other countries. What is going on in a mother? After reading 160 plus article in 14 days, every day almost 15 plus hours, my team.
Sir, please kindly unmute, sir. Dinakar sir, kindly unmute. Dinakar sir, kindly unmute, sir. Dinakar sir, kindly unmute. Kindly unmute, sir.
Sorry. So, Dr. Okay, Dr. Navya, once again, I'm sorry. Okay. All my people, okay.
Sir, ask them to remove the mask, sir.
My team, 14 hours almost, they have tortured they have beheaded my torture to read all the articles, whichever better. After reading all those things, then we have done more than 4 books. After we have sent to Central NNF, they have done some correction. Then we have done to Dr. Alpesh Gandhi. Sir has done a very great corrections. Dr. Tejavati, we have sent, she has done correction. And writing regarding the gynecology, we, in our limited knowledge, we wrote, but Dr. Jyoti and Dr. Siddu's wife, okay, Gamini, and our senior professor, Dr. Narayan Swami, and we have done. but 3 times Dr. Tejavati Madam has corrected it up to date. And we have sent it to our great person and our senior most mentor, Dr. Swarnarekha Madam. She has added 3 things. Number 1 is placental waste disposable and MTP. Overnight, 10 people have sat about this topic and read for more than 10 hours, and we have created it. Beautiful topic on MTP, placental disposable. Then Madam has advised us, nobody will, in case if somebody will read, wants to have a quick references. Why can't you have a quick reference? That also we have created. Quick reference for quick people. Number 1. And I am very happy, thankful to all the people. At the same time, what is unique is, if you'll go to the neonate, sick neonate, in one page, everything, whatever you want, you will find it. Sick neonate and normal neonate. And investigations, if you'll go, in one page, you will find everything. Even gynecology, if you'll go to the algorithmic, you will find everything. You don't be having what to do, sir, IgM, IgG, now delivered. Everything is there in that page. That is unique of this book. I request, my dear friends, 14 days, 14 hours, more than 10 people we have put effort. Thank you. Over to Prashant. Thank you.
Thank you very much, sir. Sir, I request our editorial members who have been a back support to say hi to all the attendees who are attending this one. I request first Dr. Girija, say hi. Dr. Girija, please remove your mask and say hi. We want everybody to know who you are. Thank you, ma, thank you. I request Dr. Hafiz Abdul Aziz, quick. Yeah, it's shaking, sir. Let them come near the camera. Yeah. Thank you, Hafiz. I request Navyashri. It's shaking. Say hi to everyone, ma'am. Thank you for your help and support. I request Dr. Pushpalata. Thank you very much for all the support. I request Dr. Jyoti Bandi.
Thank you.
I request Sidhu Charki. Sidhu.
Hi, Prashant.
I request Dr. Vikas. Dr. Vikas, quickly say hi. Now I request Dr. Sri Krishna RSV, our UNICEF consultant. Dr. Sri Krishna, can you mute all? Can you mute all? Can you mute all? Thank you. Now I request Dr. Sri Krishna. Dr. Sri Krishna.
Good evening, everyone. This is Dr. Sri Krishna.
Good evening.
I'm outside. I can't take my mask off, but I would like to congratulate NNF Karnataka for a landmark achievement. I've never seen a book reach the Chief Minister's desk and him endorsing it. Due credit to the effort. He would have just given you the idea, but you have taken it to the stars. And now I hope all the newborns of Karnataka and the mothers of Karnataka for whom this is aimed at, hope they get benefited. Request the government to take it forward so that everybody is aware of these guidelines. And I'll seek the support of IAP, IMA, the FOXG, NNF Karnataka with the league to ensure this is disseminated to everyone. Maintaining quality will come when you follow SOPs, and this is the first step to ensure quality care for newborns and mothers. Thank you so much for the opportunity to collaborate with you. Best wishes on behalf of our UNICEF Hyderabad field office. Over to you, Prashant.
Thank you, Dr. Sri Krishna. Now I request Dr. Arvind. Dr. Arvind.
Yes, sir.
Yes. Please say hi to everyone, Dr. Arvind. Thank you, Dr. Arvind. Now I request Mr. Nikhil Erur. We took a picture with Chief Minister today. So along with me from UNICEF, Mr. Nikhil Erur had attended. Nikhil, please say hi to everyone. Thanks for all the support. Mr. Nikhil from UNICEF. Mr. Nikhil, now I request our BPS President, Dr. Ravi Shankar sir. Ravi Shankar sir, please say hi to everyone, sir.
Yeah, hi.
Yes, sir. We can't see you, sir. Yes, sir.
I'm saying.
Thank you for all the support and
Thank you,
the generous
Dinkar.
support what you have extended for this great initiative. And we look forward to take this forward to each and every SNCs across the Karnataka. We need a complete open heart and open hand support which you have extended already. Please continue that, sir. Thank you, sir. Say hi to everybody. Thank you for being in the editorial board. So now we will move on to the next session, that is appreciation message about the book. And I would like to tell that these are the people who actually has given technical support, who has guided, as Dinakar sir rightly said, from BSOG, PSOG, IMA, Foxy, IAP, and IMA. We got complete support, and whatever we asked for, they were there all throughout till the book launch, and we expect that this continues even after that, so that we train all our nurses and doctors and they're all well. So now I request Dr. Ravi Shankar sir to speak a few words about his experience and about the book and about the occasion. Over to you, sir.
Thank you, Prashant. Thank you, the entire team consisting of Dr. Koturesh, Dinakar, Prashant, Kishore Kumar, and Ranjan Kumar, Srinath Mugli, everybody, thank you all. So we people who are born after 1920, the Spanish flu, this incident is nabhuto nabhavishyati, na heard and not to be seen also in the future. When COVID attacked the world, we didn't know how to manage the cases, especially about 1.5 months back when my department told me, sir, tomorrow one patient is getting admitted, COVID mother, and what to do. Really, I was in a shock what to do, whether to send a baby with the mother, keep it in NICU, do what other things. So I started searching for the materials, what I'm supposed to do best, legally, emotionally, and socially. And really, I felt, or it dawned onto my mind that we need a protocol in Karnataka where we had to manage such cases. So when you people suggested that one, really happily had accepted that one. It is one of the fantastic book we have given to our Karnataka people, not only Karnataka, to the entire India, so they can utilize this because everything is there in this manual. They can utilize it and manage the cases, COVID, babies, mothers, everything in a more scientific and emotional way. Emotional, I tell, because sometimes what happens, the mother's parents may not be affected. So mother is only affected, the child is may or may not be affected, and the mother will be alone and nobody else is there to look after her. So it is a very good emotional thing where mother is alone, nobody is there to look after the child and her, she is in a deep pain, whether it's a cesarean or labor pain. So this book gives us a good guideline what we are going to do with the things. So I'm really thankful to all of you once again, to the whole entire team, and I request all of us and to forward this book to everybody and all our colleagues. Let it be get benefited. Thank you once again, all of you. Dinakar, Prashant, Koturesh, Srinath Mugli, and Bidri, all, and Ranjan Pejawar, everybody. And my pranams to the teachers here, Dr. Sonareka Bhatt and Maya, by whom I learned a lot of neonatology in the early stage of neonatology in Bangalore, 1994. And my pranams to all of them. I utilize this opportunity to tell my pranams to them. Thank you all.
Thank you, sir. Thank you very much for the wonderful message and wonderful support what you are extended for this noble cause. Now I request Dr. Shantaraj sir, President IAP Karnataka chapter, to speak a few words, sir. Over to you, sir. I request all the attendees to kindly mute so that the recording will be very clear. It's going to be a memory what we are creating right now and a history what we are creating. So I request all the attendees to kindly mute themselves. Over to Shantaraj sir. Shantaraj sir.
Thank you, Dr. Prashant. I congratulate NNF Karnataka for doing this yeoman job. I thank and I congratulate all the 7 agencies who have done a wonderful job in bringing out this book, which is most essential in this context. I congratulate Dr. Koturesh, Dr. Kishore Kumar, Dr. Dinakar, Dr. Prashant, and your whole team for doing this wonderful job, and all the whole team of all the 7 agencies. I'm happy in the days of litigations, this book will definitely help us to know the correct way of treatment and to help us during difficulties. And I'm very happy that you have covered even the mental health of the mother also here, which is most important. So I congratulate you, and we will definitely support your wonderful job. And I wish you all the best in this work. Thank you. Thank you very much.
Thank you. Thank you very much, sir. Thank you very much for your kind words. Thank you, sir. So I request now Madhusudan, sir, our IMA President Karnataka, to speak a few words. Over to you, Madhusudan, sir. Dr. Madhusudan, sir. Sir, kindly unmute and then you can speak, sir. Madhusudan, sir. I think he's having technical issues in connecting. We'll come back to him later. Madhusudan, sir, are you there? Now I request Gautam Suresh, sir. Gautam Suresh, sir. So he had extended his warm wishes as well. Gautam Suresh, sir. And he had requested, in case if he's unable to join because of the duties what he's been having, he has sent his warm regards and open heart welcome for the book, and he has told that he's going to upload this particular book in his website, in the university website over there. Thank you very much for your support, and he has extended that he's going to give complete support whatever he can. Gautam Suresh, sir, if you log in again, we would like to hear from you, sir. Now I request Dr. Alpesh Gandhi, our Foxy president. Thank you very much for your support, sir. Sir, we request you to speak a few words about the situation. Over to Dr. Alpesh Gandhi, sir, President Foxy. Alpesh, sir. Dr. Alpesh Gandhi. Alpesh, sir. Alpesh, sir. I think again there is a technical issue in connecting. We will come back to you, sir. I request Dr. Shobhana Patel, our KSOG president. Ma'am, over to you, ma'am. Speak a few words about on this occasion, ma'am.
Hi, Prashant. Can you hear me?
Yes, ma'am. We can hear you, ma'am.
Yeah. So good evening, friends. It's really a pleasure to be amongst all of you. I'm Dr. Shobhana Patel. I'm the president of Karnataka OBG Association. You all agree with me that today we are in an era where we are loaded with information. And as far as the COVID is concerned, we know that the evidence is evolving. And it was very important for us to get a comprehensive evidence-based booklet, which is agreed upon by all the specialities, especially OBGYN, and we always debate, you see, in our rounds, and we always have a difference of opinion. And now we have all agreed upon, what should be done when a patient with COVID-19 sees us. And I congratulate the entire team for doing such a wonderful job. It's not easy to bring a booklet like that, and with so many people involved. I'm just hearing all your messages, and the number of people who are involved in this work, it's amazing, and I really, truly congratulate you. And I want to tell you that India is projected to have a birth of more than 20 million baby in the next 9 months. This is a this huge number we can see here. From the time the COVID was announced as a pandemic till December, we are going to have more than 20 million babies to be born. So in places where maternal mortality and neonatal mortality is high, this is going to strain us much more. And COVID-19 has posed us several challenges. It's not only to the healthcare system, but also to the patients. Patients are really scared to come. Pregnant ladies are scared to come out to the hospital, and they may not be getting the emergency care services which they are supposed to get because of this lockdown. So as far as the training is concerned, I want to tell you that Kasoga has got 20 society, Karnataka OBG Association has got 20 societies, and we, along with artists and Rajiv Gandhi University, a training program for all the paramedical people across Karnataka. So we have completed the training, and it was a very huge successful training program which we conducted. And I just want to assure all of you that Kasoga is going to give a full support in all the activities, whatever you people do, and we are just one phone call away. And I just want to end by telling I have two requests on I have a request on two issues which I have been thinking about. one is anytime we talk about COVID, we always say the data is limited. You see, and now that we are going to get the next the 6 months or so, we are going to get that many number of millions of babies which are born across India. I think we need to strengthen the registry, COVID-19 infection registry. What we are doing, we need to strengthen that, because we are not going to learn unless we have a data amongst us. It's not going to be there. I know we are all doing. Foxy also started their registry. But then we need to strengthen this, and we need to work on the process how we are going to make every pregnant lady who is COVID positive is going to be born in Karnataka. We need to have a place where we are going to record it. Second thing is, we all agree that mother and child form a special group, and all the priority testing must be given to mother, because this is an emergency services which we are providing, and these mothers must be given a priority testing. And also in priority, that equipment and the supply should be given to the healthcare providers who treat this special group of mother and child. I think with this, I thank everyone, especially Dinekar sir and Prashant, who have really been, instrumental in bringing this out. And thank you very much.
Thank you very much, ma'am. And I would like to thank your colleagues of Office Bearer, Dr. Kasturi and Dr. Vidya ma'am as well. Thank you very much for extending the support and promising that you're going to support us in full form to tackle this situation. Thank you very much, ma'am. Now I request Dr. Tejavati ma'am to speak a few words. Ma'am, over to you, ma'am. She's President, BSOG. Tejavati ma'am.
Yeah. Good evening to all the esteemed members present in this e-platform. At the outset, I would like to thank the Karnataka NNF chapter for having, involving me in addressing this issue of pandemic. Can you hear me? Can you hear me?
Yes, ma'am. Yes, ma'am. We can hear you, ma'am.
So I'm really thankful to Dr. Dinakar and Dr. Prashant, who have been instrumental, like Dr. Shobna said, in addressing this issue of COVID-19 pandemic. All of us know COVID-19 pandemic has really gripped countries all over the world, and the way the world is really reeling with its impact on not only healthcare but also social life and economy. And the worst affected is the healthcare. Now we have seen cases increasing right from month of April till now, and as of today, I was just reading the paper. The Indian number has crossed 13 lakhs, and Karnataka has reached almost 80,000, and Bangalore city is about 40,000. And this last 24 hours, there's been a steep spike in the fresh cases, which has been almost 5,000 in the state, and Bangalore city is contributing to almost 2,200. So you just see the number of cases, and even when it comes to our specialty, in the month of June, say April, June, May, June, we didn't really have that many cases. From last 3 weeks, every alternate pregnant women, we just send them for COVID testing, just delivery, and they are turning out to be positive. So just seeing the number of cases, I think there's an urgent need to tackle this problem and bring down the spread of infection. And I'm sure all of you will agree that as healthcare workers, we all play a major role. And especially doctors in the front line, they've been fighting this pandemic. And on the other hand, I should say, it's not only the patients, the paramedical staffs and the doctors, the number of them getting infected and losing the battle is really a big number. And I think we should focus on this issue also, apart from the one we are concentrating on treating the patients. Because if we ourselves, are not there, how can we treat patients? And to get a success in this, I think we need to have guidelines, to treat whether it is asymptomatic or symptomatic patients, which is very, very essential to tackle this pandemic problem and see that the curve is flattened. Now, I should say the FOGFI, that is the Federation of Obstetrics and Gynecological Society of India, was the first society to bring in this guidelines and recommendation on, to its members on treatment of COVID-19 in pregnant women. And it has released 2 issues, one in March, another in April. And these guidelines, of course, are taken from recommendations from various international and the national bodies. The National Neonatal Forum, Karnataka chapter, in collaboration with UNICEF and Government of Karnataka, is bringing out its guidelines and SOPs for pregnant women and newborn. I am really happy that some kind of guideline is there for all of us to follow immediately and clarify our doubts, because we see every day in our WhatsApp messages, our own colleagues, asking doubts. So I think at such a juncture, having these guidelines and the SOPs are going to be a really big help. And this is definitely supported by all the bodies, the IAP, Karnataka, and BSOG, and of course IMA. And I think it is important we all adapt this released guidelines to state specific and start implementing it. I, President of BSOG, I think it's my pleasure and honor to represent BSOG, and I would like to congratulate the entire NFT. And I thank you.
Thank you, ma'am. Thank you, ma'am. Thank you for your support and what you have extended. And thank you for your quick review, which we put it across today in the morning, and you came up with the help in the evening. Thank you very much for that, ma'am. And we would like to thank Dr. Shubharam, ma'am, Vice President BSOG, and your team member, Dr. Veka, Honorary Secretary BSOG as well. Thank you very much. Now I request Dr. Sri Krishna RSG, Neonatal Consultant, UNICEF India, Hyderabad Province. Dr. Sri Krishna. Dr. Sri Krishna. I think he just came. His father was not well, but still he gave a message in the editorial committee when I called him. If you're there and you're finding it a technical difficulty, we will come back to you later, sir. Now I request Dr. Sanjay Upadhyay, Health Specialist, UNICEF India, to speak a few words. Sanjay, sir.
Thank you, one and all. Am I audible?
Yes, sir. We can hear you.
Yes, boss, you're audible.
Thank you. So thanks, Dr. Dinakaran and all the team of NNF Karnataka chapter. I just want to begin saying that this is a great initiative for taking this forward. At the same time, also getting all agencies together. We all are aware that we are passing through testing times. However, we are sure that with the efforts of all of us, we will be able to overcome it. While adults can speak, they can express themselves, newborns cannot. Therefore, these guidelines are all the more important. India, in fact, has made an unprecedented progress in the domain of newborn care in last 1 decade. And we all have seen that. And these guidelines, which were developed on such a short notice on COVID-19 for the perinatal period, is another milestone in that direction. So the guidelines would remain on paper unless people start using them. Therefore, it's imperative for all of us to disseminate these guidelines to each and every corner of the state and also to the neighboring states. I wish all the best for NNF, FOXY, IMA, and their state and city chapters for coming together for developing these guidelines or disseminating them. So I thank you all for this. Thank you.
Thank you, sir. Thank you very much for the initiative, what you did, and this is where we have reached. Thank you very much for that, sir. Thank you. Now I request our National NNF President, Dr. Ashok Derari, sir. Ashok Derari, sir. Ashok, sir.
ಅದೇ ನಾವು ಯಾವತ್ತಿಲ್ಲ ಅಪ್ಲೋಡ್ ಮಾಡಿದ್ದು ಅಲ್ಲಿ ಡೇಟ್
Singh, can you mute all? Can you mute? Thank you. I think we'll get back to Ashok Derari, sir. Now I request our NNF President Karnataka, without whom this wouldn't have been possible. So he has been always there. Even yesterday I called him at 11:40. I had some issues about certain things. So he picked up the call and he responded. And he's always there whenever 24/7, whenever we call, and all the support what he extended. And we got complete support from Government of Karnataka through him. And we are very privileged, very honored for having such a wonderful human being with such a wonderful heart, who is always there. He's like a fatherly figure, telling and and supporting us in all forms. Now I request our beloved and most respected Dr. Kotreshi sir to speak a few words. Over to you, sir.
I second it, Prashant.
Thank you, Dr. Prashant. Thank you, Dr. Prashant. Much more appreciated, but without your boys' support, I couldn't have done much things. Anyway, my dear fellow academians, administrators, and co-workers with NNF, with all my office bearers of NNF Karnataka, sincerely, along with the support of UNICEF, the Government of Karnataka, especially President CM, IAP Karnataka, Bangalore Pediatric Society, and especially IMA, along with the OBG Society, Karnataka OBG Society, and National Foxy members, and Karnataka BSOG group, with all the NNF members who have been supported well with the reading this book. I'm extremely happy with hard work done by our Prashant and our Dinakar Prithviraj, along with Dr. Girija, who has done a wonderful hard work along with the entire team to bring it the SOP at the shorter time, starting from scratch and going through all the available resources, consulting UNICEF, WHO, ICMR, and for guidelines for SNCU, which is presently going for newborn survival rate. And SARS COVID virus causing behaving differently in each country. I especially thanks to Dr. Bidri and Dr. Kishore Kumar, who is our Vice President. It's a part of international working group with all the neurologists, among many others. He trying to create a uniform policy on the management of newborn affected COVID patients. And we have been taken expertise in preparing this manual. I'm thankful for this wonderful work by our editorial board, especially Bidri and Dr. Kishore Kumar. You have been prepared this manual with the current available evidence-based information, with many need to revise it periodically as a new information becomes available. For the current state, please use this manual which has been collected by our team experts. Hopefully, we should come out with this without much loss to the state or the country. And without completing, once again, I thankful for everybody who has worked with behind the scenes in many ways. I'm especially thankful, as Prashant said, we have been very good support from the government as well as our beloved CM, Dr. Sri B.S. Yediyurappa, and Health Minister, Dr. Sri Ramalu, our Deputy CM, Dr. Ashwath Narayan, and Dr. Sudhakar, Medical Education Minister. Without their support, we couldn't get the much support from the government level. And with this thing, our present situation is very much essential. This type of model, this type of progress is required. So NNFK has been added for this, along with our earlier webinar series. We have been involved much activity in this one, along with the other societies, including medical academics. I thank you one and all.
Thank you very much, sir, for your wonderful words. And we know that you are always there for us. Thank you very much. Now I request our NNF President-elect from Karnataka, 2021 for 2021, Dr. Ranjan Kumar Pejawar, sir. Ranjan, sir. I think we'll get back to him. He was also finding difficulty in connecting. We'll get back to him. We are connecting with him. Now I request our Joint Secretary, Dr. Sidhu Cherki, to speak a few words. about the occasion and book on behalf of our office. And after that, I request Dr. Leslie Lewis, sir, to speak a few words. Over to you, Dr. Sidhu.
Thank you, Prashant, for the opportunity. At the outset, I would like to thank our President, Dr. Kotresi, sir, and Dr. Dinakar, sir, and Dr. Prashant for the opportunity. I think I'll take a few seconds or so. I want to explain how Dr. Dinakar, sir, works, how this all started. I think last 1 month has been hectic for all of us, mostly for Prashant, because it was 18 to 20 hours per day. I'm not kidding, guys. 18 to 20 hours per day. Dr. Dinakar has been a constant call, and he has been pressurizing most of us. And he is one man who can get work done at any point in time. You can say, as Prashant said, it was not 2020. It was a test match played in one day. Because every day Dr. Dinakar was hitting sixes for us. And the best part was we were able to get a lot of information from across the country and globe. I think Dr. Dinakar sir and Prashant were instrumental in getting certain things from Dr. Gautam Suresh as well. And hats off to sir, through whom we could convey our book through CM Virappa sir as well. I think this book will definitely help us in managing in the periphery of Karnataka as well, because it is as simple as that, and the pictorial description is quite really beautiful. Even a simple PhD doctor can understand how to navigate or go about. There will be only nothing much required, just assistance, so that uh, management unit with COVID mother both are taken care of in this book. And I would like to discuss one more thing. Entire Karnataka hospital contact numbers managing COVID has been put in book, because that's a really great task done by Dr. Dinakar sir and us. And even we have put the online videos as well. I think once you guys go through it, you'll understand the seriousness and the hard work put in that. I want to congratulate as a team member Dr. Dinakar sir, Dr. Prashant, Dr. Girija ma'am, and our wonderful postgraduates like Pushpalata, Vikas, we call Swami in a friendly manner. Thank you. Thank you for the opportunity, Dinakar sir. Over to you, Leslie sir.
Hello, everyone. The guidelines for the management of COVID pregnant mothers and neonates has changed constantly in the last 4 months. Keeping in mind the past 4 months experience and ongoing problems and expected future problems, this evidence-based manual has been prepared by NNFK. I had yesterday gone through quickly through this all pages of this manual. It is a easy, user-friendly manual, and all the aspects starting from the pregnancy and the during pregnancy, delivery, and the postnatal management has been extensively covered up, not leaving behind any matters related to COVID. So, which tells us that last 2 weeks, this team has put the tremendous efforts. So our sincere congratulations to the entire editorial team headed by Dr. Dinakara, Dr. Girija, Dr. Kishore Kumar, NNFK President, Secretary Dr. Prashant, and the UNICEF, as well as the wonderful the editing team, because they have done a good teamwork in bringing out this quality manual. And we are sure this manual will help each and everyone in the care of maternal and child health in our country, and not only our country, in a neighboring countries who are fighting with this pandemic. Thank you, the good editorial team, and all the best.
Thank you, sir. Thank you, sir. Before we move into the editorial committee message, I request Dr. Gamini. She's also part of the editorial committee, and Mr. Nikhil to say hi. Dr. Gamini, can you please say hi and a few words quickly? Dr. Gamini.
Yes, sir. Thanks a lot for the great opportunity. And I congratulate the entire team for putting in such hard work. Sir. It's not easy. There's no words to express. Thank you so much.
Thank you, ma. I request Mr. Nikhil from UNICEF. Mr. Nikhil. All right, we'll move on. Mr. Nikhil, are you there? Yeah, all right. We will move on to our editorial committee. So now I request our Vice President, and who has been a constant support for all the academic activities, and we have seen him from last so many years, who has got passion of teaching, and he has conducted many conferences, and personally, privately also has conducted, and he has supported extreme way in terms of conducting academic activity from NNF Karnataka, and even for us in our outside the office as well. So now I request, and is the most well-read. He's a Harvard University graduate. I have got list of awards he has taken. He has been. I always tell him that I am Ekalavya and Sir is Dronacharya. So I request Kishore Kumar sir, our beloved and respected Vice President NNF Karnataka, to give a report on editorial committee. Sir, over to you, sir.
Prashant, thank you very much for the kind introduction. I am talking on behalf of the editorial committee. I have to tell you that 4 weeks ago, Prashant and Dinakar called me individually and said, we've got a proposal from UNICEF like this to prepare the manual. What do you think about it? I was in the middle of the global neonatology recommendations with the 17 of us around the world preparing neonatal recommendations for the world to be uniform. And we were downloaded with so many articles being published almost every day. And we had a target line of April deadline, but we finished by May end. That was the amount of literature we had to review. So I was almost tempted to say it is an impossible task, but knowing how Prashant and Dinakar work, I said, please go ahead and do whatever you need and we'll provide the support. They have shown that nothing is impossible. And for the last 3 weeks, they must have worked for 18 hours a day, without which this compilation and auditing, editorial, everything would have been impossible. So the credit goes to the whole team, I agree, but I think the amount of work Prashant and Dinakar have put in, they need to be congratulated and they need to be given all the support. This is the best example of all of us coming together, working for a single cause, and this shows that we can all work together for anything we want to achieve. And definitely bringing every organization under one roof and preparing these guidelines has been a mammoth task. But this mammoth task will only be useful if it is used in every nook and corner of Karnataka, if not at least whole over India. These guidelines, though, has been prepared by NNFK in association with all these organizations. There is no reason why we can't share and be used in all the states in India. Thank you very much for everybody's support, and I definitely wish the book and fight against the COVID a grand success. Over to you back, Prashant.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you very much, sir. Now I request we call him Iron Man of Karnataka because of his tough decision making and a firm person, very strong person who has established a kingdom in Vijayanagara in 2000 itself, and he's doing everything a neonatology needs to be done over there. He has got the cooling machine. He is the first person in Karnataka to get a cooling machine. He has done whatever best he can. Being in a place like Bijapur, and he was our past president NNF Karnataka, and he has taken wonderful decision at that time, and he has successfully conducted so many conferences, and he has called the international faculty and many delegates and attendees which witnessed attendance during our state conference. I'm speaking about Dr. Lakshman Bidri sir. Sir, we are very proud of you, and that's why we call you Iron Man of Karnataka. Over to you, sir. Sir, kindly unmute, sir. Unmute, sir.
Yeah. Good evening, Prashant. Hello. Yeah, tell me.
Yes, sir. We can hear you, sir. Over to you, sir. Please speak a few words, sir.
Already I spoke, no?
Sir, we want to hear you once again, sir. Bidri, sir. Lakshman Bidri, sir, we want to hear you once again, please.
I am proud of my team, the NNF team. They work day and night to bring out this SOP on guidelines for antenatal, intranatal, postnatal, newborn management of COVID-19. And this will go a long way in helping neonatologists, pediatricians, and obstetricians to manage the patients with COVID infection. Am I audible?
Yes, sir. Yes, sir.
Yes, sir. Yes, sir.
Yeah. So wonderful work done by the NNF team. And especially, I'm very happy that in this busy schedule also, Kotrish was able to get the appointment of Chief Minister, and we got the full support of the government. I'm very happy about that. Thank you.
Thank you very much, sir. Thank you very much for your wonderful words, sir. Now I request Dr. Narayan Swamy, sir. Narayan Swamy, sir. Narayan Swamy, sir.
Hello. Yeah, can you hear me?
Yes, sir. Yes, sir. We can hear you, sir. Go ahead, sir.
Can you hear me?
We can hear you, sir. Go ahead, sir. Go ahead, sir. We can hear you.
Good evening again, and I think it's nice to be with you all. And this COVID-19 has posed numerous challenges to humanity. The threat to the lives of pregnant women and newborns remains a challenge. And the disease is going to change the way we live. It has already changed the way people and of an organization coming together, making this reality, and it will go a long way to update the knowledge of this COVID-19, and it will help all the practicing obstetricians and gynecologists and neonatologists to give the best care to the concerned people, and it will help a long way. And I really thank each and everyone, particularly Prashant, Dinakar. What a wonderful personalities, and I really appreciate the commitment and the hard work. And I hope this book will really help all the people concerned. Thank you.
Thank you, sir. Thank you, sir.
Very much.
Thank you very much. Yes, sir. Now I request Vijay Kulkarni, sir, to speak a few words, sir.
Prashant, how are you? Hello, Prashant. Hello, Prashant.
I can hear you, sir. Go ahead, sir. Go ahead.
Prashant, good evening, my dear friend. Good evening, Prashant, Dinkar, and all my senior faculty who are on the online today. Thank you very much. I really congratulate the NNF team and the editorial team for doing a fantastic job. Actually, lockdown has been such a gloom period for all of us, and you have taken it such as a God-given opportunity, and you have released this SOP amongst even this lockdown period. So you have showed the academicians that how this gloom can be taken up as an opportunity. And Dr. Dinakar, hats off to you. Dr. Prashant, hats off to you for taking out a wonderful SOP. In fact, to tell you, we have 10, 11 babies in our SDM who are COVID positive mothers. In fact, this SOP has been such a use to me. I'm bringing it into practice. I thank once again the editorial team for bringing out this wonderful SOP. Hope it goes a long way and maybe it comes in revised edition. Thank you so much, Prashant. Thank you.
Thank you very much, sir. Thank you very much, sir. Now I request our past president, NNF India, VP Goswami, sir. So he has been a phenomenal support right from the beginning for Karnataka and throughout India as well. Sir, we are very, very happy to invite you, and we are very happy that you have made time in your busy schedule to come to this book launch. I request you to speak a few words to you, sir. Few words from you, sir. Over to you, sir.
Right. Thank you, Dr. Prashant. and respected Professor, Senior Professor Dr. Maya sir, Swana Rekha madam, Dr. Baliga sir, and NNF Karnataka team, especially Dr. Bidri sir, Koturesha sir, and all my friends, Dr. Kishore Kumar, Prashant, Dinkar. I think Karnataka is my second home. Am I audible? Am I audible,
You are
Prashant?
audible, sir. Go ahead, sir.
Okay, okay. So Karnataka is my second home, and I am delighted to be there on the virtual platform. Thank you so much, Karnataka team and Prashant and Dinkar. I think we can address the continuum of care by involving all the partner organization. So very nice that you have involved UNICEF, Oxy, and even my friend Dr. Ravi Shankara is also there. So IAP also you have involved. So thank you very much for that. I could see and I have seen that the list of topic you have already shown that could be very much useful if implemented properly. So thanks to the editorial team also, and I thank all of you for inviting me here, and wish you best of luck. And I know that Karnataka is on the forefront as far as NNF is concerned. You did a lot of commendable activity this year also, in the past also. So my best wishes to all of you, and thank you for inviting me. Thanks again.
Thank you very much, sir. Thank you for wonderful support and making time on this occasion. It means a lot for us. That your presence means a lot for us. Now I request my favorite, BD Bhatia sir, to speak a few words. Bhatia sir? BD Bhatia sir?
Sir is there?
Yes, sir. He was around. Bhatia sir? Sir, now I request Dr. Santosh Suvan sir to speak a few words. Suvan sir? Yeah, I think there's a technical issue in connecting. Now I'm going to invite a lady, a strong lady, a firm lady, and she's very dynamic, very impressive, and she gives a lot of motivation for all of us. The best part about her is she constantly updates her knowledge. Any latest journal comes, she always updates within a span of couple of days. I request Dr. Asha Venkappa ma'am to speak a few words. Asha ma'am.
Thank you, Prashant. Am I audible? Am I audible?
Yes, ma'am. Yes, ma'am. Yes, ma'am. We can hear you, ma'am. Go ahead, ma'am.
Thank you very much. I must say the book is exhaustive, excellent, comprehensive, collaborative, evolving compilation of almost a nascent data into standard reference protocols, a much needed authoritative guidelines. I'm very happy it is pictorial with excellent algorithms. The authors have taken cognizance of the fact that the scenario is dynamic and things may change any time. They've given us a warning at the beginning, and it can be, you can go local or local, and it can be modified according to your local situations. From references to web links and update on vaccines. It's an excellent manual and no words. Hearty congratulations to the team leaders, Dr. Bidri, Dr. Kotresh, and our international man, Dr. Kishore Kumar. Ably supported by the young, energetic, academic Turks, that is Dr. Prashant Gowda and Dr. Dinakar. They are COVID connectivity, communication, they have kept us all occupied, and we look forward to this. But for them, there was absolutely no human faces we were seeing. Their NNF webinars, which they conducted in the last few months, has set such high standards, and it is exemplary. And they go by the belief, just like in Goodbye Polio, every drop counts. So every member has been taken cognizance and everyone has been counted, and they strongly say we are together. Thank you.
Thank you, ma'am. Thank you, ma'am. Thank you very much for your wonderful words, ma'am. Thank you, thank you. Now I request Dr. Ramesh Kumar, sir. He's a past secretary IAP 18 and 19, and he's from Kerala, and he has extended his support in terms of circulating the protocol and helping us in terms of reaching the information to the mother and child across Kerala and his known places. Now I request Dr. Ramesh Kumar sir to speak a few words. Over to you, sir.
Respected dignitaries on board the August platform, senior academicians, and my dear friends. I'm quite delighted to see the Karnataka NNF has responded to the need of the hour. And you have brought out a consolidated guidelines as have been put out by our experts, Dr. Ravi Shankar, as well as our ma'am from the obstetrics side. It is the consolidated guideline where it has been agreed upon by the National Neonatology Forum, the Obstetrics Forum, the UNICEF, the government, the IAP, and this is something which we have been really looking forward to. It has been a scary experience when a pregnant lady used to come to for the COVID, maybe for the delivery, maybe 2 months back. Our obstetrician was really scared to give her for COVID ladies admitted about. We are not sure. But now we have a lot of guidelines are there. We have to take the baby, keep the baby separate, what to do. And now also a lot of COVID information is coming up. But the consolidated line guidelines agreed upon by all the collaborative partners is something which we are really looking forward to, and you are really responded to it. I'm so happy that your team has done a great job. I've learned here. I've been sitting for the editorial team led by Dr. Kishore, who have been a human service of a doyen in this field, and the team from Dr. Kichu, Dr. Sidhu, Dr. Jodi, Dr. Girija, and the dynamic duo of Dr. Dinakar as well as Dr. Prashant. They are joint academic neonatology academics in Karnataka for quite a game changer has come from Neo Gurukul. So that has been great, and congratulations to the great team led by Dr. Kotresha, who had been in combination with the government to get things going, and the Secretary Dr. Prashant, IAP President Karnataka Dr. Shantaraj and Dr. Nadesh, IAP BPS President Dr. Ravi Shankar was always a thrusting force behind all these moves, and our teachers, great teachers with your guidance, Dr. Bidari, Dr. Sanajaka, Dr. Mayam, and our Dr. Srinath Mukali, and all those who have been around, and our HST, Dr. Basavaraj, and your mentor there, the IAP President boss, Dr. Sandosh Sons. So it's a great going in Karnataka IAP, and as suggested by Dr. Kishore, we are ready to take up these guidelines. As has been, how much of effort has been put into this, we will really be ready to replicate these guidelines either in the other states or ready to take up as such in Kerala, where I would like to, we have got a meeting of NNF tomorrow, and we would like to present it in NNF and IAP forums, because a lot of work has gone into this, and we are really, not many people have really ought to go into it and change it again, because it is as such 4 months data has been really been experienced, has been really been put into it by the young thugs and young talented thugs out there. Congratulations, Prashant, for going ahead in a big way, and team Dinakar and all those around, and Dr. Kishore and all those Karnataka IAP, NNF, and the Kotresha sir and the stalwarts. Thanks for the opportunity for being here with you. And thanks a lot, Jai IAP, Jai NNF. Thank you.
Thank you, sir. Thank you, sir. Thanks a lot. Thanks a lot for extending the support. Thank you, sir. Now I request Bhatia sir. Bhatia sir, can you speak a few words? After this, we'll go for a book launch. I will tell you how to do it. Bhatia sir. Bhatia sir. Bhatia sir, are you able to connect now? Meanwhile, Bhatia sir is able to connect. I will tell you what to do. So next we are going for the big thing, and it's a new thing. So I request, I've sent a high resolution COVID-19 protocol, the last one which I have sent. So I humbly request everybody to open up in your mobile the protocol book, and we request all of you to take a picture about the protocol opening up of the first page, and we'll simultaneously do it with a countdown. So Bhatia sir has come now. Bhatia sir, are you there?
ಏನೋ ಕೊನೆಯಲ್ಲಿ ಪ್ರೋಟೋಕಾಲ್ ಪಿಕ್ಚರ್ ತಗೊಳಕ್ಕೆ ಇನ್ಸ್ಟ್ರಕ್ಷನ್ಸ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ ಕೊನೆಯಲ್ಲಿ ಏನೋ ಫೋಟೋ ತಗೊಳಕ್ಕೆ
So now I request to open up the latest protocol soft copy which we have sent with high resolution, the last one which I have sent, and I request to delete all other protocol. This is the latest one which I have sent for you. The last one which I have sent. Kindly open that in a countdown of 10, and please show it to the camera if you can.
Prashant, have you sent it by mail?
WhatsApp, sir.
WhatsApp.
Prashant, last page, huh?
First page.
First page. Okay. Fine.
Sir. So I think it's a wonderful time now. Shall we start with a countdown? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Please unveil the book. Please unveil the book. I request all of them to unveil the book. All my chief guests to unveil the book. I think this is a unique situation and unique opportunity where all of us have come together for this wonderful occasion, and we are doing it in a very, very different way. That's in the e-platform. So it is for the first time in an NF Karnataka platform, and where we all have come together, even for other organizations as well in Karnataka. I think this is going to continue for next 2 years, 2 to 3 years minimum, till we get an effective vaccination. Wonderful moment. Thank you very much, all of you, to open. I request all of you to open the book and kindly share. We humbly request to kindly share this soft copy book with your bodies. We're going to upload in our website as well, and we humbly request to upload the soft copy in your respective society website so that it reaches each and every corner of Karnataka and beyond Karnataka and across India. So if there are any suggestions, if there are any feedback, we are open to that. And please write to us, please contact us, please send an email to us. We are just one phone call away. We request all of you to kindly circulate this in your circle. Now, before we close, Dr. Venkata Chalapati sir has come. He has been very, very instrumental. Thank you all for unveiling the book. Thank you very much. And we request our chief guest and the speakers for today to kindly WhatsApp me the photo of the book with you and the book, soft copy of the book, or you can take a printout of first page of the book and take a photo. Please send it to us. We're going to upload this occasion and this moment. So now I request Venkata Chalapati sir, who has been very phenomenal support for us in terms of getting connect with the government. Thank you very much, sir, for your extreme support. And you are just one phone call away. And you have been very, very phenomenal support. When I went to Krishna Chief Minister office, I could see your influence over there. It has been phenomenal. Thank you very much. So now I request Venkata Chalapati sir to quickly speak a few words. Over to you, sir.
Oh, thank you very much, Dr. Prashant. Good evening, everyone. At the outset, I would like to thank the organizers for giving me this opportunity to be part of this program. In my opinion, when the going gets tough, the tough gets going. This is very aptly fits into the current scenario where there are extraordinary measures taken by the multidisciplinary professionals to counter the extraordinary difficult times of pandemic like this. And I wish to congratulate on behalf of, in fact, the state IMA, IAP, all the esteemed members for their contribution and success in bringing out this wonderful book. So even I have gone through especially the feeding part in the newborn period in this one or two chapters that has been wonderfully depicted. So I congratulate everyone, and I thank once again the team of NNF headed by Dr. Koturesh, Dinakar, Dr. Prashant, and even from the gynec side, Dr. Narayan from Kolar. So I thank one and all. I congratulate once again all the people who have contributed for this wonderful guidelines. Thank you so much. Over to you, Dr. Prashant.
Thank you very much very much, sir, for your wonderful support, what you extended for us. Thank you, and it means a lot. Now I request our BD Bhatia sir, if he has joined. Bhatia sir, are you there? Because you are finding it very difficult. And he has been a phenomenal support, and he has been a constant blessing he has showered over us from the time he was president, even before that. Thank you very much for all the support, sir. Bhatia sir, if you're there, we would love to hear from you.
Prashant?
Yes, sir.
Yeah, before we go, I mean, just one suggestion. We can have one helpline where if any pediatrician, neonatalist all over Karnataka finds any problem in managing the COVID child or any suggestion, we can have that helpline to guide them. Probably it will be one useful suggestion. If feasible, you can please go ahead. I'm not just a suggestion. That's all it is.
It's a fantastic idea, sir. We'll sit across, and then definitely we'll discuss, and we'll come up with a workable plan to continue this till the situation ends. It's a good idea, sir. We will definitely take up. We'll discuss with our president and vice president and office, and with you as well, and we will see. Sir, Dinakar sir, are you there?
Prashant, Dr. Basavaraj
Yes,
sir
sir
is there.
Yes, sir. Yes, sir. Yes, sir.
And Dr. Bhatia is also, sir, is there.
Sir, kindly mute, sir. Kindly mute the multiple device which is on. Bhatia sir. Bhatia sir. Till then, we have our secretary IAP India, who has won with a phenomenal margin. That speaks that how approachable he is across the country and how friendly he is across the country, and he has been very, very close to us. Anything we ask, he'll never say no, and he will put his 100% effort, and is very, very, very approachable, very, very, very humble, and most respected, most loved person. And he is one whom we look upon as he is one who will not have any enemies. He's such a wonderful person. Basuraj sir, we would like to hear from you, sir. Please speak a few words, and we would want your complete support from you for this initiative. Basuraj sir. Basuraj sir, are you able to connect?
Prashant.
Yes, sir.
Also on the line, he can talk.
Okay, sir. Okay, sir. All right. So now we'll move on to the next session, that is vote of thanks. Bhatia sir, if you're around, you can speak a few words. It's all right. Yeah. So we will move on to the vote of thanks. Thanks is the last word which can be expressed at this situation. This is the situation where we need to come together, and we need to exhibit the strength. And what happens when we come together? This is the example. On a flat, such a short time, we are able to come up with a world-class evidence-based medicine with support and association of all the bodies across the country. So we would like to thank Indian Academy of Pediatrics, Karnataka. We would like to thank Bangalore Pediatric Society. We would like to thank KSOG. We would like to thank BSOG. We would like to thank IAMA. We would like to thank NNF India. And we would like to thank the entire members of Neonatology Fraternity and Pediatric Fraternity who have extended their support directly and indirectly. And most important, we would like to thank our backbone of our editorial team, the Vaidehi nursing staff, the coffee what they have served, and all the postgraduates who have been a phenomenal help and have worked day in, day out, day in and day out. We would like to extend our thanks to the entire government officials from our beloved and respected Chief Minister of Karnataka, B.S. Yediyurappa ji, Deputy Chief Minister Dr. Ashwath Narayan, Medical Minister Dr. Sudhakar, Health Minister Sri Ramulu. So we would like to extend our thanks to Javed Akhtar sir, and a complete this wouldn't have been possible without the spark, and the spark has been created by UNICEF India. So I would like to thank Dr. Sri Krishna, Dr. Sanjeev Upadhyay, Dr. Nikhil, Mr. Nikhil, who has been a phenomenal help for us in terms of getting the invitation to getting the work done. Thank you very much, and we would like to extend our thanks to the entire team of NNF Karnataka office, our joint secretaries, all the joint secretaries, executive board members, and our entire fraternity. And it is not nice to thank our president and vice president, but still we would like to thank all of them who have been a phenomenal support till date, and all my staff here in my clinic, Mr. Prashant Singh, who has been constantly calling up and trying to connect and trying to resolve the issue, Manjula, our receptionist over here, and Aman, who has been a backup support for all the IT related things. And I would like to thank Mr. Shivu for creating the letterhead. So I would like to thank the team, the printing team near the Vaidehi as well, who have worked with us day in, day out to bring this formatting and booklet. So if I've missed anyone, kindly excuse me. It has been a wonderful platform, wonderful opportunity, history in making that this program has gone for 2 hours, and we were fortunate enough to hear from all the legends of their fields who have done a lot of surveys, and they've all come together sparing their time. A great thanks for all of them. Thank you, sir. Before I conclude, I request our President, Kotreshi sir, and our Vice President and our Treasurer, Dinakar sir, to speak a few words and conclude the meeting. Over to you, Kotreshi sir.
Hello. Good evening to everybody, especially for the team. It has been a wonderful event gone through ever in my academic activities. All the involvement of state governments and all the medical fraternity, all the department, all the subjects have been involved in the invention of newborn activity itself. Our main aim is to make a 0% newborn mortality at the end. So this COVID book also definitely will help for maternal and child health care, especially for the newborn period. And NF has done a wonderful job. Especially thanks for Dr. Dinakar, Dr. Prashant, Dr. Bidri, and also Dr. Prashant, Dr. Kishore Kumar, who has done a wonderful background for this booklet. And especially our team has been, including Dr. Girija, has involved various people also involved in all the medical fields and fraternity. I once again thank you for who have been involved actively and taken care for the betterment of newborn in the field of COVID situations. Thank you, one and all. I'm very much happy for this and very namaskaram. I want to accept body.
Thank you, sir. Thank you, sir. Sir Kishore, sir, closing comments, sir.
I sincerely thank everybody on behalf of all the hard work that we become.
Sir, kindly unmute, sir. Kindly unmute, sir.
Hello. On behalf of NNF Karnataka, I want to thank everyone. And the hard work of everyone is going to be realized only if the book is used in every nook and corner of Karnataka and possibly India, so that we can fight COVID together. This is the best example of everyone fighting together, and we have to beat this COVID, and we have to save all of the population from suffering. So wish you all the best in the fight against COVID, and hopefully this book will make a huge difference. Thank you very much.
Thank you, sir. Thank you, sir. Now I request Dinakar sir to give a closing comment. Over to you, sir. Unmute
other devices. Andru Randra, Enaka. Correct question. Sir, Dinakar sir, closing comments, sir.
Yes. I think first mute on.
Yeah, Prashant. Yes, sir.
Excellent organization, and one more thing is NNFK. Always I do call mother. We are helping our mother, making her strong by all these academics, and our plan is only. I told Dr. Kishore Kumar sir and our Kutresh, with their help, we want to make one house for the NNFK mother, and with their help, without any expectation, number one, and just I request everybody to leave their all egos and other things. Please help for our to make one house for the NNFK. Thank you. Very good program, Prashant and Kishore and other people. Bidri sir, thank you very much your support, and all our joint secretaries. Great work and supporting us, and great work from our team. Without our team, nothing would have been done. Thank you, dear friends.
One more thing, when the NNF Karnataka, we took office under our President Kotresh, the aim of the year under his presidency was to reach every nook and corner of Karnataka, and we reached that through webinars. Now we are reaching through the COVID protocols, and we have a lot more things to do before we can reduce the infant mortality to acceptable levels. Thank you very much.
I would like to say a word of definitely with the support, definitely we are going to make a house in Karnataka, especially in Bangalore.
Thank you, sir. Thank you, sir. And final thanks for all our associate societies who have made time. KSOG, BSOG, IAP, IMA, NNF India, IMA. Thank you very much for your warm support. Thank you. Thank you. We will conclude the program. Thank you for your wonderful time. We will be sharing the recorded video with you, and all the photos. As I said, we want one photo to be taken and sent it to me as a WhatsApp. So we'll make a big collage and send it back to you. Thank you, thank you, thank you, thank you, thank you, all the attendees who have attended this program for so long. Thank you, thank you, thank you, thank you, thank you, thank you, thank you.
Thank you.
Thank you. Thank you. Thank you. Thank you, sir. Thank you, sir.